Are you concerned about the health of your bones? Osteoporosis is a common condition that affects many people, particularly women as they age. If you're looking for a way to shield your skeletal health and prevent bone loss, Raloxifene hydrochloride might be the answer you've been searching for. What is Raloxifene hydrochloride? Raloxifene hydrochloride is an FDA-approved medication that has proven to be effective in treating and preventing osteoporosis. It belongs to a class of drugs known as selective estrogen receptor modulators, SERMs. Unlike traditional hormone replacement therapy, Raloxifene hydrochloride specifically targets estrogen receptors in the bone tissue, providing the benefits of estrogen without the risks associated with systemic estrogen therapy. How does Raloxifene hydrochloride work to prevent osteoporosis? Raloxifene hydrochloride works by mimicking the effects of estrogen in the body, which helps to increase bone density and reduce the risk of fractures. Estrogen plays a crucial role in maintaining healthy bones, but as women age and go through menopause, estrogen levels decrease, leading to bone loss. Raloxifene hydrochloride helps to counteract this process by binding to estrogen receptors in the bone, stimulating the production of new bone cells, and inhibiting the breakdown of existing bone tissue. In addition to its bone-building effects, Raloxifene hydrochloride also has the unique ability to lower the risk of invasive breast cancer in postmenopausal women with osteoporosis. This is a significant benefit for women who are at risk for both osteoporosis and breast cancer, as it provides a dual-action approach to their health concerns. Benefits of Raloxifene hydrochloride for skeletal health. The benefits of Raloxifene hydrochloride extend beyond its ability to increase bone density and reduce the risk of fractures. Studies have shown that this medication can also improve overall skeletal health by reducing the risk of vertebral fractures and improving spinal alignment. By taking Raloxifene hydrochloride as prescribed, you can strengthen your bones, reduce the risk of debilitating fractures, and maintain better posture and spinal health. Another advantage of Raloxifene hydrochloride is its positive impact on cardiovascular health. Research has demonstrated that this medication can reduce the risk of heart disease and stroke in postmenopausal women. This is particularly important, as women with osteoporosis are at an increased risk of cardiovascular complications. By protecting your bones with Raloxifene hydrochloride, you're also taking steps to protect your heart. Raloxifene hydrochloride dosage and administration. The dosage and administration of Raloxifene hydrochloride may vary depending on the individual and their specific needs. It is typically taken as a once-daily oral medication, with or without food. It's important to follow your healthcare provider's instructions and take the medication exactly as prescribed. Your healthcare provider will determine the appropriate dosage for you based on factors such as your age, medical history, and the severity of your osteoporosis. They may also recommend regular bone density scans to monitor your progress and adjust your treatment plan if necessary. Potential side effects of Raloxifene hydrochloride. Like any medication, Raloxifene hydrochloride can cause side effects. However, not everyone experiences these side effects, and they are generally mild and well tolerated. The most common side effects include hot flashes, leg cramps, swelling of the hands and feet, and joint pain. These side effects usually subside over time as your body adjusts to the medication. It's important to note that Raloxifene hydrochloride should not be taken by women who are pregnant or breastfeeding, as it can cause harm to the fetus or nursing infant. If you experience any unusual or severe side effects while taking this medication, it's important to contact your healthcare provider immediately. Who should consider taking Raloxifene hydrochloride? Raloxifene hydrochloride is primarily recommended for postmenopausal women who have an increased risk of osteoporosis. This includes women who have gone through early menopause, have a family history of osteoporosis, or have certain medical conditions that can lead to bone loss. Your healthcare provider can assess your individual risk factors and determine if Raloxifene hydrochloride is right for you. It's important to remember that Raloxifene hydrochloride is not a one-size-fits-all solution. Some women may not be suitable candidates for this medication due to underlying health conditions or other factors. Your healthcare provider will consider your unique situation and recommend the most appropriate treatment plan for you. Comparing Raloxifene hydrochloride to other osteoporosis treatments. When it comes to osteoporosis treatment, there are several options available. Raloxifene hydrochloride is just one of many medications that can help prevent bone loss and reduce the risk of fractures. Other common treatments include bisphosphonates, hormone replacement therapy, and calcitonin. Each of these treatments has its own set of benefits and considerations. Raloxifene hydrochloride, for example, offers the advantage of not increasing the risk of breast cancer, which may be a concern for some women. However, it may not be suitable for women with a history of blood clots or certain other medical conditions. It's important to discuss the pros and cons of each treatment option with your healthcare provider to determine which one is best for you. They will take into account factors such as your medical history, current medications, and personal preferences to create a treatment plan that aligns with your needs and goals. Tips for maintaining skeletal health alongside Raloxifene Hydrochloride. While Raloxifene Hydrochloride can significantly improve skeletal health, it's important to complement its effects with other lifestyle measures. Here are some tips to help you maintain optimal bone health. Get regular exercise. Engaging in weight-bearing exercises such as walking, jogging, or weightlifting can help strengthen your bones and improve overall bone density. Eat a balanced diet. Ensure you're getting enough calcium and vitamin D in your diet, as these nutrients are essential for bone health. Dairy products, leafy greens, and fortified foods are good sources of calcium, while sunlight and supplements can provide vitamin D. Avoid smoking and excessive alcohol consumption. Smoking and heavy alcohol intake can increase the risk of osteoporosis and weaken your bones. Quitting smoking and moderating alcohol consumption can help protect your skeletal health. Prevent falls. Take precautions to reduce the risk of falls, as they can lead to fractures. Use handrails, wear appropriate footwear, and keep your home well lit and free from hazards. Regular checkups. Schedule regular checkups with your healthcare provider to monitor your bone health and adjust your treatment plan if necessary. By incorporating these habits into your daily routine, you can maximize the benefits of Raloxifene Hydrochloride and maintain strong and healthy bones for years to come. Conclusion: empowering your skeletal health with Raloxifene Hydrochloride. Don't let osteoporosis hold you back from living a full and active life. Raloxifene Hydrochloride offers a powerful solution for protecting your bones and preventing the debilitating effects of bone loss. With its unique mechanism of action and proven results, Raloxifene Hydrochloride is a valuable tool in empowering your skeletal health. By taking this medication as prescribed and incorporating lifestyle measures to support bone health, you can strengthen your bones, reduce the risk of fractures, and maintain an active and fulfilling lifestyle. Consult with your healthcare provider to determine if Raloxifene Hydrochloride is the right choice for you and take control of your bone health today.